Effectively, everyone in society today uses at least one form of social media. Whether that's Facebook, Twitter, Instagram, TikTok, or YouTube, you've probably used it. At least speaking from personal experience, it's super easy to scroll through forever, getting lost in the powerful algorithms that keep you engaged and realistically keep you wasting a lot of time and energy when you could have been doing something else productive. One thing you probably don't know is that there are very useful applications for social media in medicine, although there are definitely really destructive applications too. But regardless, today's clinical trial is the first to look at TikTok and its ability to reduce anxiety in people going into surgery. So let's take a look into it. What's up everyone, my name's Henrik and welcome back to the channel. Today I'm breaking down a trial looking at the effects of a TikTok intervention to reduce anxiety before going into surgery. This was published in June of 2021 by a few doctors from the Zhejiang University School of Medicine in China. Originally released in 2016, TikTok has become a very popular social media source, primarily because it's super easy to go through a lot of content very quickly. It's also very useful to get information, and there's over 70 papers published over the past 3 years looking at TikTok content. There's papers looking at TikTok topics for climate change, plastic surgery, alcohol, teeth, and skin disorders, and realistically a lot of random things. And I can direct you to a link in my description where you can find all of those papers. But to date, there's only one published clinical trial on TikTok, and it looks at it through a lens I've never thought about before personally, before I read this paper. I find TikTok pretty distracting, and I've scrolled through it way too many times as I'm preparing this video, but there could be significant positive uses for it, positive applications. So let's break it down. Looking at the study design, this was a randomized controlled clinical trial with 80 individuals between the ages of 18 and 45 who were going to go under general anesthesia for some surgical procedure. They had to be low risk for complications with anesthesia, and they couldn't have any significant psych disorders like depression, general anxiety disorders, and things like that. In this study, there were two groups. There was the intervention group and the control group. In the pre-operation room prior to the procedure, the intervention group was given a phone with TikTok and was allowed to scroll through it for 20 minutes. They were also taught how to use it, and they scrolled through the For You page. The control group simply didn't have a phone to use TikTok. In total, the researchers measured things at two different time points, before the 20 minutes and after the 20-minute scrolling period. They measured blood pressure and heart rate and anxiety using something called the Amsterdam Preoperative Anxiety and Information Scale, which is known to be a validated and accurate test. It is also reliable, and here's a table of what it actually looked like, what the questions they actually asked. And in addition to this Amsterdam scale test, they also used a second test called the Anxiety Visual Analog Test to strengthen their results. Because if you have two anxiety tests, they both say the same trend, stronger results. They also measured the patient's satisfaction with anesthesia, but this was after the procedure rather than the 20-minute scrolling period, so that patients would have time to experience the anesthesia. Looking at the results of both anxiety tests, anxiety significantly decreased in the TikTok experimental group, and they were more satisfied with their anesthesia relative to control. Systolic blood pressure also significantly decreased to a lower level, and the systolic blood pressure is the blood pressure when your heart is actually contracting. Typically, blood pressure can spike under stressful scenarios, so this is another great marker that showed a decrease in stress and anxiety. In Table 2, we can see that everything in the TikTok group was significantly different relative to baseline, less than that 0.05 p-value, but only the anxiety, satisfaction with anesthesia, and the systolic blood pressure SBP was significantly different relative to control, and therefore that's the only important part of these results. I think this study is super cool, and it's the only clinical trial ever to use TikTok in any way. But there have been studies out there that have used Instagram and YouTube, other social media platforms. Although this is definitely not the first study to look at ways to reduce pre-operation anxiety in cool ways. A study in 2012 found that listening to music, favorable music, can have similar favorable effects like this TikTok study did. Another study in 2019 found that when comparing music versus an anti-anxiety medication, they have similar outcomes, meaning music can act as an anti-anxiety medication in some ways. But if TikTok can reduce anxiety, that's incredible, especially because you can just hand someone a phone with TikTok rather than having to select favorable music or pay money for expensive medication. I also think it's really cool to think about what other scenarios can you use TikTok to reduce anxiety. Maybe you could think about before a test or a concert or a presentation, but I don't know, there's a lot of potential opportunities out there to use TikTok in this way. However, it is important to note that there were a lot of limitations and confounding variables in this study. Besides the basics of us having a small sample size and all subjects being from a single hospital in China, we don't really know if the anxiety-reducing effects were specific to TikTok or just because they were on their phone, because the control group wasn't on their phone. The study also never talked about what the control group was doing. So if they were just lying there, waiting for their surgery to happen, then I would assume it's a lot more stressful than literally doing anything else to take your mind off of it. Additionally, everyone likely had different procedures they were going to go into, and there are definitely more riskier surgeries out there than others, and that could have played a significant role in bias in the study. It is important to note these limitations, but I still believe that TikTok itself could have had some real effect on these study measures, and this study provides a great start to the utility of TikTok in medicine. Looking at the key takeaways of this study, today's randomized clinical trial showed that preoperative TikTok intervention reduced anxiety and blood pressure and increased satisfaction with anesthesia. This was definitely more of a pilot introduction study and the first published clinical trial ever to use TikTok. But it really shows that TikTok can have the potential for medical uses like reducing anxiety for surgery. I think the more interesting aspect is what other scenarios can TikTok be used for to reduce anxiety, and I'm really curious to see more research in that area. Honestly, I'm not sure how you can directly apply these results to your life unless you're about to go into surgery. Hopefully not, but at least now you know that social media sources like TikTok can be useful in medicine. And who knows, maybe if you're feeling really stressed and anxious, maybe pull out your phone and scroll through TikTok for a little bit, and maybe that could help. But regardless, I'm not here to provide recommendations, and specifically, I'm here to provide a nice breakdown on the first published clinical trial on TikTok. But that's all I really had for today. All the papers and sources I've used are in my description below, along with a list of all the original research papers that have looked at TikTok content. But regardless, don't forget to like, comment, subscribe for more content, and I hope you all learned something. So have a good one. Thanks.